and optimizing all embryological procedures for a better outcome in IVF. Okay, so I'm requesting Dr. Dharmesh to start the session.
Good morning, good evening to everyone. I hope I am very clearly audible. So last time we had discussed about how embryology procedures they help to improve IVF outcome. Now we are moving towards the embryology lab, IVF lab, and we will be discussing few points. Embryology is a huge subject. We cannot cover all the points in a single 1 hour talk. But yes, I would like to pinpoint specific areas which require fine tuning, so ultimately our embryology results improve. Okay, so we have to master all the following points. Then we can have a fantastic results in our embryology lab. What we have to look for is culture conditions, which also includes culture media, temperature, pH, information about VOCs in the lab, various procedures like OCC screening, fertilization process, either it is IVF or ICSI. We should be knowing about embryo grading. The most important part in the whole IVF process is embryo transfer. That we should be knowing. Vitrification and thawing, they are inseparable and very important part of our day-to-day procedures. Unless we master them all, we cannot optimize our results. And lastly, most important is prevention of infection. Okay, so let's start with the culture media. As all of us are working in the embryology lab, basically there are two types of culture media. One is media rather. One is culture media and one is handling media. As the name only suggests, culture media means we are culturing either the embryos or the blastocyst in the culture media. The media in which we are culturing the embryos, it is called culture media. And handling media, any media which we are using, most probably it is HIPPIS buffered media. That media, when we are using outside CO2 environment, that means outside incubator, and we are handling gametes, either it is oocyte or it is sperm, that is called handling media. Now culture media has bicarbonate buffer and which requires CO2. So all the culture dishes we usually put it in the incubator, and the CO2 maintains the pH of the culture media. The same way handling media. In handling media, we are not putting the media inside the incubator. We are working in the normal environment. So the CO2 is less and maintenance of pH can be an issue. So it contains HIPPIS buffer media. HIPPIS is hydroxyethyl piperazine ethane sulfonic acid. That is the buffer, and that maintains the pH without help of CO2. Now this is just diagrammatic representation how the embryo develops. Usually the fimbria, once it is been, the oocyte has been captured, the sperm reaches at the late part of the fimbria and the fertilization happens here and the embryo formation starts. So you can see till day 3 to day 4 conversion, the embryos are in the tube, and after that the embryo comes in the uterine cavity. So day 4 and day 5 development, and further till day 6, day 7 development, it happens in the uterus. Now we can have open culture where we have a dish with media which is not covered with oil. We can have volume difference like large volume, small volume. We can culture the embryos either in single embryo in each drop or few embryos in one drop, that means group culture. But there is no consensus till date what is the best. But always keep it in mind to minimize the stress of the embryos. So you have to keep it in mind: temperature, pH, osmolality, light, and most importantly concentration of CO2 and O2. Now, day in day out, the most important part which we are doing is preparing the dishes. All of us must be using different way of preparing the dishes, different size of the drop. Some using normal mineral oil, some people are using hard oil, some guys are culturing in central well dishes, some guys are preparing smaller drops, some guys are preparing bigger drops. Now, most importantly, if everything is working normally, if you are getting good results, then whatever works well for you, you should be continuing. But what is ideal? Usually 20 to 30 microliter drop if you are preparing, then you can do group culture, you can put 4 to 5 embryos in one drop. If you are doing single embryo culture, some embryologists they prefer culturing each embryo in different drop. In that case, you can prepare a little smaller drop. Now, what is important here is, what is the importance of group culture? Each embryo, it develops autocrine factors which goes in the culture media and which again helps for development of the same embryo. That is, these factors are called autocrine factors. And what is paracrine factors? Like one embryo is developing some substances which is helpful for the other embryo to develop, and these are the paracrine factors. So if you are doing group culture, then you can have advantage of both autocrine factors as well as paracrine factors. Now, when initially IVF was started, there was only one media which was prepared, that was HTF, human tubal fluid. As I have showed you in the picture previously, the tube constituents we have mimicked and we have prepared a media, and in that we were culturing. Now, as the time progressed, IVF has got evaluation. What we have understood is there is different requirement for cleavage cell embryos and for the from morula to blastocyst embryos. So we have started preparing sequential media. That means fertilization and cleavage media, and one is blastocyst media. So usually we culture embryos. If we are using sequential media, we are culturing the embryos till day 3 for cleavage media, and day 4 and day 5 we are culturing in the blastocyst media. Again, few years we have used sequential culture media, and the concept of again single step media has come back. So we are now square one. Again, most of us are using single step media, but basically it has evaluated from single step media, then sequential culture media, and again single step media. Usually there is different need of embryos at different stages. Important thing here is change of dishes. Why it is important? Because when you are putting the embryos in the drop or in the micro droplet, there is fixed amount of constituents, energy sources, vitamins, amino acids. So as the time passes, there is depletion of that resource, that sources, and so it is important to change the embryos in the fresh media. And again, one more important thing is, by doing so, you can also help prevent the infection. Now, one most important problem which can happen while we are culturing the embryos, that is ammonia. Ammonia is very toxic to all the embryos. Amino acids in the media, it built up ammonia while we are culturing the embryos in the incubator. It has negative impact on embryo and the fetal development. Now, how can you get rid of it? So you have to, if you change the media on day 3, even if it is a single step media, if you change the media on day 3 and you put them in a fresh media, so again you are decreasing the amount of ammonia. Use of proper assortment and concentrations of amino acids. There are few amino acids like dipeptide form of glutamine which are producing very less amount of ammonia. So these are the amino acids which are very much in use in the newer media, and that's why a lot of people, a lot of embryologists from this meeting must be utilizing the same media for culturing the embryos after IVF or ICSI till day 5, and still they are not having a lot of ammonia production in the media and the embryo quality is good. That is due to the change of some of the amino acids. So ammonia is very important byproduct of amino acids in the culture media which can be harmful to the embryos. Now, if we look about other culture conditions, what makes our embryos good or what can distort them? First is pH, temperature, osmolality, and of course it is air quality. Mainly it is VOCs, that is volatile organic compounds. If, as we all of us know, all the body fluids have 7.2 to 7.4 pH. That means the pH of most of the body fluid is alkaline. Now, intracellular pH, what it does? It regulates enzymatic reactions, cell membrane calcium concentration, communication, protein synthesis, and cytoskeleton formation. Now, if there is slightest variation in pH, so if you are working in the lab and you are keeping your dish outside incubator, the culture dish outside the incubator for a longer time, what can happen? There are two things that can happen. One is temperature shift. We are supposed to keep the temperature at 37 degrees Celsius, but the temperature will go down. And the another factor which we cannot see by naked eye, that is pH variation. So what happens? Slight variation in pH, it can impact blastocyst development, alter gene expression profile. It can induce relocation of mitochondria in the cytoplasm. It can, and actin cytoskeletal elements. It can alter glycolytic activity and oxidative metabolism. So pH variation can have a huge impact on development of embryo. Now, one more important thing about pH is it is very much dependent on altitude. pH, how we are maintaining pH in our lab? We are using CO2 incubators. So CO2, whichever is supplied to the media, it reacts with the bicarbonate buffers and it maintains the pH, as we have discussed earlier. Now, as you go higher altitude than the sea level, the CO2 requirement increases. So it is not the same CO2 which is required to maintain pH. Like you have a media, okay, you are ordering a media from a company which is suggesting that you should have a 6% CO2 to maintain pH of 7.3. Now, if you're going to a different center where it is at a much higher altitude, then the CO2 requirement might not be 6%. It will go up, and it is been proved that in some of the places it has gone up to 11% of CO2 requirement to maintain pH about 7.2 to 7.4. So it is very important to consult the media company whenever you are starting your IVF place, specifically when the place is located at a much higher altitude. Now, the pH of media, we are talking about pH of media, but what actually important is intracellular pH, the pH inside the cell, and it is being controlled by the pH of the media. So if we are keeping the media outside CO2 environment, and if the pH changes, that pH is going to affect the intracellular pH of that cells, whether it is cell embryo, whether it is oocyte, or whether it is blastocyst, and that is going to harm the embryo. Now, one more important thing, and I would say one of the most important part which we have to always look after is temperature. Keeping control of temperature is very crucial. We know we are keeping all the desks, all the incubators at 37 degrees Celsius. Now, whenever you are dealing with the oocytes are very sensitive to temperature difference. So while you are doing the first process, the oocyte pickup is going on. When you are doing oocyte screening, that is the time you have to be very careful. While you are doing ICSI, when you have cleaned the OCCs of all the cumulus cells and you are doing ICSI in outside environment, that is the time very crucial that there should not be a lot of temperature shift, because if that happens, there are high chance that the spindle which is the nucleus of the oocyte, it can get disrupted. So human microtubules are highly thermosensitive. That means they are very sensitive to the temperature variation. A slight reduction in temperature can cause spindles to temporarily disassemble, and low temperature can cause irreversible changes to the spindle. And if these irreversible changes happen, the chromosomal distribution will be bad. When you will fertilize that egg with the sperm, the resulting embryo can have some sort of aneuploidy because of the genetic issue, genetic disarrangement of the spindle, and yes, ultimately your result will suffer. So this is very important. Now if you talk about the embryos, they can sustain the temperature variation little better than the oocytes, but that doesn't mean that we have to take longer to deal with the embryos. But most important part is the fertilization process. So whenever we are doing IVF or ICSI, we have to be very fast. We have to make sure that this is the environment which is not suitable for oocytes, sperms. So we have to finish the process fast and put them in the culture media as soon as possible. Now these are the two graphs. It just shows you how temperature affects. So as all of us know, the normal ambient temperature at which we are working in any IVF lab, that is around 24 degrees Celsius. So it almost takes 20 minutes for the temperature to reach at 37 degrees Celsius. So as soon as you open the incubator, the temperature of the dish starts going down, because the ambient temperature in the lab is around 24 degrees Celsius and your expected temperature is around going to be 37 degrees Celsius. So there is steep decrease in temperature, and that is the area which you have to always look after. Second thing is, as soon as you take out the dish outside the incubator, as you have seen in the lower chart, what I would like to see is, when you take out, it is at 37 degrees Celsius. As soon as after within 1 or 2 minutes, the temperature goes to 36 degrees Celsius. And as the time passes, the temperature goes down, and probably after long, like 14-15 minutes, even the heating plates, they are not useful to maintain the temperature at 37 degrees Celsius, because the temperature of the heating plate is going to be at 37, while the temperature of the ambient or the IVF rabbit is going to be around 24 degrees Celsius. So this is the issue. So guys, to have the best efficiency in your embryology lab, the most important part for you guys to do is you have to be fast and efficient. This is very important. Now we'll talk about different incubator systems. I know previous days, in the early days of my practice, there were only big incubators were available. They are called box incubators. As the time passed, then the benchtop incubators came into existence, and the latest addition in that was time-lapse incubator. The most important thing about incubator is, we do not know which system is the best incubator, which one works the best. Most importantly, what we have to look for is the cost, convenience, and comfort. So basically there are two types of incubator. One is box type and one is benchtop type. So one is working incubator, one is culture incubator. Usually in any lab we have minimum 2 incubators. The box incubator usually we use as working incubator. That we use is to put our dishes, culture to equilibrate our culture media, and benchtop incubators nowadays are only used for culture. If we, as all of us know, Heracell, Binder, Aztec, these are all the incubators which are box incubators. They are certified for IVF procedure, and usually they are humidified incubators. All these incubators have water pan inside, and they are creating humidity inside and creating the natural environment. If you talk about benchtop incubator, as we know, Cook is the company, Labotech, Miri, there are a lot of others. They sometimes uses premixes gas. I will come to that. That's a very important topic about the gases which we are going to use. They usually use 5% O2, 5 or 6% of CO2 and rest nitrogen. And when you are using premix gas, we rely on the company a lot because company creates the mixture and they give us for utilization. Now there is one type of incubator where you are going to use premix gas. There is another type of benchtop incubator where there is inbuilt gas mixture like K-Systems, like Iscomeri, like Aztec. These are, most of the incubators are dry incubators. This is very important. Previously all of us were culturing the embryos in the humidified environment. Nowadays most of the incubators, they are dry incubators, and there is a difference, guys, how we have to culture the embryos in a dry incubator. In all these benchtop incubators, they have inbuilt mixture. So, and there is a IR sensor, infrared sensor. So it maintains the CO2 requirement of 6%, O2 requirement of 5%, and rest is nitrogen. And the best part about using benchtop incubator is the recovery rate is very, very fast because of the smaller space. So if we talk about grossly about the differences between the box incubator, I'm sure a lot of you guys must be culturing in the box incubator. If you are doing 2 or 3 cases in a day, you are going to open the incubator a lot of time. Most of the big incubators, they are around 150 liter of capacity. So whenever you open the incubator, the whole amount of air which is inside the incubator, which is having 6% CO2, it all comes out. And the air from outside environment, it goes in. And the outside environment is not going to have CO2 concentration of 6%. It is hardly less than 1%. So in that case, there is sudden shift of pH. So the more you open the incubator, the more the pH shift is there, the more temperature shift is there. So nowadays, that's why it is always advisable, the bigger incubators one has to use for the working incubator, and for culturing, benchtop incubators are preferable. Now, if we talk about time lapse, there is one more new entity which was not recently introduced. It has been in existence since many years, but due to its very, very high cost, it is not being used by almost all the IVF clinics. But let me tell you something about it. It is again a simple dry incubator with a camera inbuilt. And what it does capture the images at different stages. Like if you have kept the eggs for fertilization, the next day at 16 to 18 hours, you want to see the fertilization, then you have to go to the lab, open the incubator, take out the dish and see for the 2 PN, that is 2 pronuclei and 2 polar body. But if you have time lapse, by just looking at the software, you can see at what time, whether there are 2 PN or whether there is 1 PN or whether there is 3 PN. So the best part about time lapse is it decreases unnecessary stress to the embryo and it gives uninterrupted culture in the same environment, and that is the biggest advantage. But yes, again let me tell you, it's a dry incubator. Second thing, it is the cost of the time lapse machine is too high, so it depends how to use it. There are few companies which is providing it. Now let us talk about gases. So as we talk, what is importance of CO2? CO2 is important. Why? Because it maintains the pH of the media. So reduced O2 concentration. And so there are two things. CO2 is important to maintain pH, and reduced O2 concentration, it can be beneficial in human embryo development and outcome. I'm sorry for the interruption. Okay, so we were at gases. So CO2 concentration is required to maintain pH, and reduced CO2 concentration is supposed to be beneficial in human embryo development and outcome, and that how it works will be letting you know. So if we talk about CO2 incubator, there are two types of incubator. One is normal CO2 incubator and one is triple gas incubator. These are the common terminology we are using. So regulation of CO2 concentration is very important for regulating pH, as we discussed. CO2 incubator, it uses atmospheric air and CO2 from the cylinders. So the CO2 concentration is 6%, but the O2 concentration is as equal to as which is in the air, and that is around 18 to 20%. So there is high O2 concentration in only CO2 incubators. Now O2 levels in the reproductive tract are reported to be very low, like 2 to 8%, and its higher amount can be detrimental to embryo development. So new studies have shown that culturing embryos in 5% of O2 concentration is found to be beneficial when specifically blastocyst culture is to be done. As all of us know, most of you are very much in favor of doing blastocyst culture only, then you should be using triple gas incubator instead of the only CO2 incubator. Now, why O2 control is needed? What it does wrong? So O2 is considered as secondary stressor. It causes stress to the embryo culture, and some studies have suggested that it can lead to abnormal fetal development. It produces ROS, that is reactive oxygen species. So all the new incubators, the triple gas incubators, they are maintaining oxygen concentration at 5%. But still, the scientists, they are trying to decrease the requirement of O2 concentration to even 2%. So if you culture the embryos at 2% level from morula stage onwards, it has shown healthier embryos as O2 tension is speculated to be very less in the oviduct. Now, whenever first thing we have understood is we should be using triple gas incubator for culturing. So well controlled CO2, controlled oxygen, and rest is nitrogen. Now, how we can use this? So there are two type of gases are available. One is premixed gas. I would say two type of incubators are available. Some incubators, they require premixed gas. So the company provides you with a cylinder which is having 6% of CO2, 5% of oxygen, and rest is nitrogen. These are called premixed gases. Now here, you have to rely on the company that they are giving you the perfect mixture. The air quality of the gas, air quality of the room air, that is again important where it is being prepared. So we rely heavily on the company to provide perfect mixture every time. Now it is difficult to check the gas concentration of the cylinders all the time. But let me tell you, whenever you are getting a premixed gas, it is mandatory for you to check CO2 concentration of that cylinder before you start it. As CO2 is heavy, it settles at the bottom. So what happens when the cylinder is going to get empty? All the impurities and everything gets settled at the bottom. So don't wait for the CO2 for the cylinder to get fully empty. Before it is fully empty, still there is some amount of CO2 left. You have to change it with a newer cylinder. Now, another type of incubators which we had already discussed, they are having gold mixtures. That means they are having mixtures which aspirates CO2 and maintains CO2. They aspirate nitrogen, and nitrogen has a capacity to control oxygen. So by having a nitrogen cylinder and the mixture, it maintains the O2 concentration of 5%, and the rest of the amount is nitrogen. As we had again discussed, low oxygen is useful, and studies have demonstrated that it has shown very improved human embryo development, implantation, and pregnancy rates, specifically at low oxygen and specifically for when you are doing blastocyst culture. So big box incubators, they can accommodate more dishes due to more space, and benchtop incubators, they have a lesser volume. If you talk about temperature recovery, as I have talked, bigs of box incubator, if takes 20 to 25 minutes to recover the temperature again to 37 degrees Celsius, and benchtop incubator takes 5 to 6 minutes only. So you can see the huge difference in recovery. If we talk about CO2 recovery, large incubator relatively high, benchtop incubator takes very less time, like 8 minutes. Humidity recovery, if we talk about larger incubators, it is relatively high, while benchtop incubator it takes again. So crux of the story, by telling you all this information about incubators and its gases, is utilizing bigger incubators or the box incubators as a working incubator and benchtop incubator as a culturing incubator. Second thing, have a triple gas incubators for culturing and CO2 incubators for gassing of the media. Now, as we have discussed, most of the newer incubators, they are they are dry incubators nowadays. Why? Because previously almost all the incubators, they were humidified incubators and they were producing fantastic results. But there was a chance of having infection because the environment is humid, there is temperature is 37 degrees Celsius. So there is chance of fungus infection or some other sort of infections in the incubator only. To get rid of that, the concept of dry incubator has come. But then again, what can be the problem when you are using dry incubator? So when you are using dry incubator and you are preparing a dish with micro drops, you are covering with oil. What happens after 2 to 3 days or during that time is there is evaporation of water. So the osmolality increases. So osmolality is a major factor. Now what is osmolality? The ions in the media, we know what all the constituents of the media are. So they make the largest single contribution to osmotic pressure. Now what is normal osmolality? It is around 275 to 295 milliosmoles. In IVF laboratory, it is essential to monitor the culture system to make sure that the osmolality doesn't exceed 300 milliosmoles. Now, as we are checking pH and temperature routinely, we are not checking osmolality so frequently. And that's why we have to make sure that the osmolality variation is not there. So to ensure the osmolality of any given culture medium, it is important to use an oil overlay, very important, and to cover the drops of the medium as quickly as possible. So whenever you are preparing your dishes in the morning, just before oven pickup starts, when you are preparing the dishes of the culture media, first of thing is your laminar flow is on, and as soon as you prepare the drop, the evaporation starts. So it is important to do that procedure fast and to cover it with oil and to put little more oil when you are culturing with the dry incubator. So if we talk about air quality, usually we were always worried that the air quality is more or less, it is all about infection. It is not so. Infection doesn't happen only through air. There are other means. Sperm is one of the major contributor for any infection that can happen in the dish. So if we talk about the quality, outside air quality has an obvious impact on atmospheric quality within the incubator, especially CO2 incubator, because in only CO2 incubator there is 6% of CO2, but the rest is the air. Approximately 95 to 94% of room air that goes in the incubator. Now if we talk about benchtop incubators, premix gases, the quality of gas from the supply tanks must be considered, especially in low oxygen incubators where nitrogen is flushed to reduce O2 concentration. So when we are using benchtop incubators, the quality of the gases matter, because when the gas quality is bad, again it can produce a lot of VOCs. So what is VOC? It is volatile organic compound. They have been detected in gas supply tanks used for IVF. So how can we decrease that? So all the incubators nowadays, we have inline filters. So between the cylinder and between the incubator, there is an inline filter which contains HEPA filter to reduce particle count, and it also uses activated charcoal or potassium permanganate for absorbing the VOCs, and it has shown improvement in embryo quality. So if you guys are not using inline filters, it is high time you have to put inside inline filter between all your cylinders and between the incubators. All the plastic waste which you are using, they are already gassed to sterilization. So when you put these all dishes inside it, again it can produce VOCs. So VOC may still rise in the incubator as the temperature goes up. So proper cleaning of incubators and degassing of all these devices, disposable dishes, all these are very important. Embryos are very sensitive to environment, and VOCs are one of the vital factors which are affecting embryo development. VOCs, what is VOC? Basically, they are hydrocarbon based compounds that have a high vapor pressure at room temperature, and they are very detrimental for IVF outcomes. They are emitted from anything and everything which is there in the laboratory, like instruments, furniture, if someone is wearing perfume, aftershave, cosmetics. These all things can produce a lot of VOCs. So according to the present day findings, if VOCs are over 1 particle per meter, they are directly toxic to the embryos, and ideally its level should be less than 0.5 ppm. We have VOCs meter available, and by just checking the VOC you can understand the air quality. When you are working in the lab and suddenly there are a few guys who have come for a training, and if you check the VOC level, it goes quite high. So it is very important for us to work with limited people in the IVF laboratory. Now from the instruments, let us go to all the procedures we are doing. The first procedure in the embryology lab on the day of pickup, what we do is OCC screening, oocyte cumulus complex screening. What is important is timing. Don't take a lot of time, because you are working outside the incubator. The temperature of all the heating plates are going to be 37, but the air temperature is not going to be 37. So there is high loss or faster loss of temperature. Again, always use HIPIS buffered media. Once the screening is done, wash them properly in the buffered media, transfer to the fertilization media, cover it with oil, and transfer the dishes to the incubator. So this is the most sensitive area. If you take longer, like you have 20-25 OCCs or 24 to 25 follicles, and if you go on waiting longer and longer, gathering all the OCCs, and you're working in the outside environment, your results start decreasing from the just start of the process. So it is very important to do OCC screening very fast in HIPIS buffered media, and then you transfer in a fertilization media. Now, the most important part, for which our profession is in existence, that is a fertilization. What is in our hand in the whole embryology processes? The most important thing is the fertilization. As we know, timing of fertilization is very important. What time you are doing pickup and what time you are doing fertilization. Now, IVF, as we know, it is a conventional insemination system of doing fertilization, and the most recent is the ICSI. So if we talk about IVF, the time duration, as I have told you, after how many hours of pickup you do insemination, with how many sperms, very important. As we discussed in the last talk, all the sperms should be capacitated. So proper sperm washing is very important before we do insemination. Now, whenever we are doing insemination, we have to make sure that when we are putting the sperms, we are not only putting the sperms in the drop, but with that little bit of seminal plasma is always going to be there, and it can change the pH, it can change the osmolality. Now, whenever we are doing IVF, there is a high chance of having an infection, and all the males which are undergoing IVF procedure, ideally they should be given empirical antibiotics, even though there is no infection or evident infection. Or if you want to be specific, you You can always go for semen culture. If you find any bacteria or bacilli, yes, you can treat that, and then you can take up the patient for IVF. So when you inseminate, there is change in pH, there is change in osmolality, and there is chance of infection too. But yes, you have to take care, and you can get rid of both the issues. Now, these are the advantages. What is the biggest advantage of IVF? That the God is going to select the sperm. We don't have to worry. So God will select the sperm, and that sperm will fertilize the oocyte. But what can be the problem with IVF? I'm sure a lot of you guys must be doing a lot of IVF, and fertilization failure is a big risk. The next day, whenever we go to check the fertilization, we are always worried. We are always having little bit of anxiousness in our mind when we go to check the fertilization, whether there will be fertilization or not, because you are keeping the OCCs and the sperm in the same dish, and you are expecting this one of the sperm will fertilize the oocyte and you will have a beautiful zygote. So there can be a chances of total fertilization failure. There is a chance of having less fertilization. Nowadays we know most of the patients, the era has come that the patients are coming little late. The AMH of the females have gone down. The number of follicles have gone down. The sperms have gone. The sperm quality has gone down. These are all adding up to the problem of fertilization failure. And when you have less number of OCCs, the chances of having fertilization failure is there. And if you have no embryo after IVF to transfer to the patient, then you can understand the situation. Most of the places IVF is not being covered by the insurance. The patients are paying from that pocket, and as we know, it's a very costly affair. Being an embryologist, we are not directly coming in contact with the patients. This is the irony of this profession, yes. But we should be knowing that the patient is paying through their pockets. It's a difficult task for them. They are doing a lot of jugglery in their life to gather that money. And if we are telling them that I did IVF with 5 of the OCCs and there is no embryo formation and we are going to cancel, so the patient has to again take all the injections, all the costs they have to bear, she has to take again anesthesia, the procedure of pickup has to be in. So whenever you are doing IVF, you have to be very precise. You should be sure about the semen or the sperm quality that you are going to have IVF embryos. Now, ICSI. ICSI is very prevalent in our part of the world. Most of the patients we always try to do ICSI. Now, what is important in ICSI is, ICSI is a very technical process, and if given a training, anyone can do it. Any life science student can do the ICSI. But then they become a technician. Unless you don't know the andrology, you don't know the sperm, the morphology, then you cannot choose the best sperm. And the best part about being a good embryologist who is doing good ICSI is the sperm selection. It is the key element. What is another most important thing and technical one is proper alignment. If you don't have a proper alignment, there are high chance that you are going to lyse the oocyte. While you are doing ICSI, you are doing ICSI in Hippis Moffat media. Some of the guys do ICSI in culture media, but I still prefer ICSI is always to be done in Hippis Moffat media. So why? Because it can maintain the pH of the drop when we are doing ICSI outside the incubator. So what is important is speed and efficiency. These both have to go together for doing good ICSI. There are sometimes, it's not only about your alignment or your ICSI process, but sometimes the oocytes are fragile. The elderly female is having degenerated oocytes, the vacuolated oocyte. There is a high chance of oocyte degeneration. So it is not always the ICSI procedure which can cause oocyte degeneration. With ICSI, the biggest thing which we have to keep it in mind is transmission of male factor infertility. Though this topic very much belongs to our IVF consultant who is counseling the patient. So if we talk about ICSI and IVF, we are in our part of the world, we very much rely on ICSI. Whenever where there is low number of oocytes, high elderly patient, low AMH patients, we try to go for ICSI. At least we can have some embryos to transfer. And if the patient is having male factor and there are good number of oocytes from the female, then we always do IVF and ICSI. The best part, let me tell you here, is whenever we have embryos with IVF and when we have the embryos with ICSI, I will always prefer to transfer embryos with IVF because the selection of the sperm is natural. Now let me take you through few of the newer papers which have shown some interesting points. Piezo ICSI, it has been developed. Piezo ICSI is a sort of device which reduces oocyte degeneration while doing ICSI and it improves success rates. So there was a study when does piezo, the study was done to understand that whether it improves the overall success rates of ICSI operations compared with the conventional ICSI. So answer was yes. It has showed lesser degeneration rate during or after ICSI operations to the conventional ICSI. So what happens while we are doing ICSI, we are putting the needle inside the oocyte, we aspirate the cytoplasm, and when there is a sudden give way of this, the olema, we push the sperm inside the cytoplasm. So we are actually mechanically by force breaking the olema, and that can sometimes be harmful to the oocytes. But yes, by doing piezo, we don't have to break it, it itself breaks it very smoothly. We don't have to aspirate the cytoplasm to break the olema, and the piezoelectric current, it just gives way and the sperm can be deposited in the cytoplasm very easily. So this is all about fertilization we have discussed. Now another important point, a day-to-day and a very interesting topic which I always discuss in so many conferences is when to transfer the embryo. I think nowadays there is a whole lot of embryologists, all the clinicians, there is a feeling that they all want to do blastocyst culture. Basically, we have to understand why the concept of blastocyst culture has come into existence. Previously, they started with zygote transfer, then they came for day 2 transfer, then came day 3 transfer. Nowadays, everyone is behind day 5 transfer. So blastocyst culture has the advantage that we are going to have a natural selection. Like on day 3, we are going to have 8 on 10 embryos, good quality 8 embryos, and we have to transfer 2 embryos. Then that is our choice. It is embryologist who is going to choose which is the best. So if we culture them till blastocyst, like from 8 to 10 8 cell, if we have 5 to 6 good quality blastocyst, so that is a natural selection. So now instead of 8, you have to choose from only 5 blastocysts, which are the 2 good blastocysts and which you have to transfer. So the concept of day 5 or blastocyst transfer, the most important thing is availability of good quality embryos either on day 2 or day 3. Good quality as well as good number. Second advantage of blastocyst culture is synchronizing the embryonic stage. As we know, till day 3, the embryos are going to be in the tube, but when we are doing embryo transfer, we are putting the embryos directly in the endometrial cavity. So it is hypothesized that synchronization of day 5 embryos is better with the uterine cavity. Third thing is, till day 2, all the embryos which are developing, they are under maternal genomic control. So the paternal genome hasn't activated yet. So all the development is governed by the maternal genes. As there is a transformation from day 3 to day 4, day 2 to day 3 embryos, from 4 cells to 8 cell embryos, the parental genome, that means the genome of the oocyte as well as the sperm into existence, and the development is controlled by the parental genome. So one more important thing is uterine contraction. This is more of a clinical importance, but all patients exhibited contractions in the uterus on day 2 and day 3 after retrieval. but the contractility decreases. That means when you put the embryos, the contractility of the uterus, it can cause expulsion of the embryos, and that is more while you are doing day 2 or day 3 transfer. As the time goes, as the progesterone in the body goes up, the contractility decreases and it is very less during day 4 or day 5. And again, if biopsy procedures are to be done, then it is always advisable to go for trophectoderm biopsy, because there are many cells, easy to remove, than having a day 3 or day 2 biopsy. So this is just for our understanding the blastocyst scoring system. This was recently updated in ASHRAE consensus on oocyte and morphology assessment topic, and we all of us are well aware with this staging. Staging depend on the stage of expansion of the embryo. Then the grading also depend on the IC inner cell mass, how the quality is, and about trophectoderm also. So nowadays there is one more concept coming, that is extended culture till day 7, is it good? So if the embryo is not arrested, what is embryo arrest? So if any embryo doesn't develop or doesn't grow for 24 hours, then it is supposed to be stamped as arrested embryo. So if the embryo is good but it is a slow pace, like on day 3 you see there are 4 to 6 cells, day 4 you see still it is 8 cell stage, day 5 you see there is a morula or there is a cavitating morula only. These are the embryos, they are not arrested but they are growing so slow. So there is a it's not a recent article, but few years before this article was published, it has showed that it is recommended that extended culture to day 7 can be incorporated in the practice, especially for patients who have embryos that have an early or borderline grade on day 6. So you are not sure about their grading on day 5 or day 6, that you can wait for day 7, and if they develop very nicely, you can freeze them and you can utilize those embryos in the next cycle. But this is to be done when you don't have a good quality blastocyst on day 5. If you have enough good quality blastocyst on day 5, you should be first utilizing those embryos only. Now, if we talk about another true process, that is vitrification. Let me complete this transferring day 3 and day 5. So it is not that if we transfer on day 2 and day 3, the success rate is going to be low. For all the elderly patients, those patients which are having poor ovarian reserve, less number of embryo, you can always transfer on day 2 or day 3, preferably day 3. If you try to culture these embryos till day 5, yes, sometimes you can get good blastocysts, but sometimes you can have no blastocysts to transfer, and this again you have to cancel the cycle, and again the patient has to undergo stimulation and all sort of issues. So as in medical practice, it is being said that there is no fixed rule. You have to treat the patient individually according to their need, their pathology, their ovarian reserve, their sperms quality, everything. So you cannot pinpoint that all the patients we are going to do day 3 transfer, all the patients we are going to day 5 transfer. It a lot depends on the patient variability. So if we talk about vitrification, since the vitrification came into existence, we have started doing freeze-all technique. The implantation rate has improved drastically. So if we talk about vitrification, the most important thing according to me is timing. You have to work in a very precise timing. If you go beyond that, if you are keeping your embryos longer in vitrification solution, which is supposed to be done within a minute, then you are exposing the embryos to very, very unusual environment for longer time, toxic environment, and the embryolysis or embryo development can get deteriorated. So that is one important thing. Second thing is precision, because all of us know vitrification solution is going to be a thick viscous solution, so it is not going to be tackling the embryos as easy as we are doing with in the normal culture media. Now all the media are very much optimized. Previously, when we were doing slow freezing, the results were not good. But when vitrification has come into existence, the media is optimized. We are sure, and we at our center we assure that we are going to have 100% survival rate. We are not going to have any blastomeal lysis after vitrification and thawing process, and all of us should be practicing this. Thawing, if we talk about thawing, it is a more crucial step in vitrification on thawing. So if you are little bit away from your timing in thawing, or you are not doing as per protocol, you will have lysis and your embryo will stop growing. So 100% survival, a lot depends on a very perfect and good thawing. Always keep an eye on maintenance of liquid nitrogen in the container when you are keeping your embryos in the liquid nitrogen container. Now, which day to transfer, or we have discussed which day to transfer. Now the question is which day to vitrify. All of us have seen that we can transfer on day 2, day 3, or we can freeze the embryos or vitrify the embryos on day 2, day 3 and day 5. So day 3 and day 5 vitrification is a very common practice. But day 4 transfers and day 4 vitrification are not so common. Why? Though day 4 is the day, it's the day when morula, the embryo develops to morula. That is the ideal most day when the embryo comes from the tube to the uterine cavity and it develops there. So that is the most ideal time. But why we are not transferring? I haven't heard of any clinic who is transferring on day 4 or who is doing freezing on day 4. The reason being the morphological grading. When you try to grade 8 cell embryos, it is easy. Looking at the size and shape, number of the blastomere, fragmentation, it is easy to distinguish between 2 embryos. With the morula, sometimes it is difficult to choose which one is the best one among the whole lot of morula. If we talk about transfer, like if we try to transfer on day 4 and we have rest of the embryos to freeze, in that case, when we try to do freezing, we try to avoid day 4 freezing. The reason being, freezing is the process of all of us know. Vitrification is we have to dehydrate the cells. So we get rid of almost all the. I'm sorry. Right? Okay. So we have to get rid of whole lot of water, and it is been replaced by the cryoprotectant. So if we are using day 4, it's a compacted cells. So the transfer of the fluid shift is not proper. So sometimes if you freeze or vitrify the day 4 embryos, morula embryos, and you thaw them, sometimes you can have lysis in the center of the embryos. So these are the 2 reasons why no one is very much in favor of either transferring on day 4 or vitrifying the embryos on day 4. So let us go through few of the papers. Effectiveness and safety of single poor quality blastocyst in comparison with single good quality blastocyst. So the study question was comparison of pregnancy and perinatal outcomes in blastocyst with poor inner cell mass. So one blastocyst is having poor inner cell mass, one blastocyst is having poor trophic product. So which one is giving better results? So the summary answer is poor trophoblast quality blastocysts, they have a little better pregnancy outcomes than poor inner cell mass quality blastocyst. A lot of time we have this confusion when we see 2 of the blastocyst. So which one to transfer? In that case, this study can help us. Now, blastocyst speed versus blastocyst morphology. That means if on day 4 you see there is a cavitating morula, not a perfectly blastocyst or not a fully expanded blastocyst, and the other side there is a fully expanded blastocyst but the morphology is not good. So which one will you prefer? So the study was to compare predictive value of pregnancy and live birth of morphology versus morphokinetic assessment of blastocysts. So the study shows that blastocyst morphokinetic, that means morphology as well as the timing, they are not superior in predicting pregnancy. So what is important is it's not all about the timing, it is more about the morphology of the blastocyst which is going to help you. They are all equal. So you can have a blastocyst which is little slow growing but with good quality that you can always transfer. Okay, in vitrification thawing, this is a common observation that re-expansion of blastocyst we always look for. So there was a paper, it was a paper published in 2023, that relationship between re-expansion rate of vitrified blastocyst during recovery post-thaw and what about the pregnancy rate. So what is the relationship between re-expansion rate of vitrified worm blastocyst and pregnancy rate? So the answer of this study is re-expansion rate of vitrified worm blastocyst was higher with increasing the number of trophectoderms. So when the trophectoderm is good, the chances of re-expansion is good. Now there is a case after thawing that after 2 hours of post-thawing, how you analyze the blastocyst expansion. So the study question was, the aim of this study was to evaluate the influence of blastocyst re-expansion time of one vitrified blastocyst. So you have frozen a blastocyst, you have thawed it, and after 2 hours you are checking for the re-expansion. So clinical pregnancy rate was significantly higher after transfer of one vitrified blastocyst that have fully expanded. So the crux of the story is you have to look for the re-expansion after 2 hours of thawing. So those blastocysts which have gained the shape as it was previous to vitrification, then re-expansion is good. These are the blastocysts which you should be transferring post-thaw. And the last part about our talk is embryo transfer. Guys, let me tell you, embryo transfer is the most important procedure in the whole IVF process, let it be the clinical side or let it be the embryology side. We have to make sure that everything depends on the embryo transfer. Whatever injection, hormonal injections patient has taken, whatever amount they have spent for that, whatever based media you have used, whatever based ICSI you have done, whatever culture conditions are there, everything is done. Now it's the time of judgment day. So in this day you are going to transfer the embryos. So which are the most important factors that can affect the results? There is amount of media which you are going to use when you are transferring the embryos, whether to flush or not to flush the catheter, the amount of force you are using to transfer the embryos, the placement where you are placing the embryos, and most importantly, embryo transfer catheter should be radiolucent. So while you are doing transfer, it has to be always under sonographic guidance. And in sonography, if you could see the tip of your embryo transfer catheter properly, then you can do the perfect embryo transfer. Some of the centers, they do pre-warm the catheter, because when you are taking small amount of volume of media with the embryos, and if the embryo catheter is not pre-warmed, the temperature can go down. And optimal volume is again important. When there is a too large a volume, it can cause expulsion or it can cause ectopic pregnancy, because with the fluid the embryo can get pushed to the tube and it can get implanted there. And if there is too less volume, sometimes the embryos can stick to the catheter only and they can come back. So these are the few things which is very important, and I think I have tried to cover almost all the areas where we can improve or we can rectify. And let me talk about our academy. It is Zygon Academy of Training in Clinical Embryology and Reproductive Medicine, and we are very much in a training part for the hands-on embryology training, and for the clinicians we are giving short-term courses for ovarian stimulation protocols, USG, etc. So our services, what services we are providing is, first is clinical training. More than 150 gynecologists from Africa, Middle East and Asian countries have got trained at our academy. And clinical IVF batch is usually shorter, 10 to 15 days. For the embryologist, yes, our 4 weeks courses. That means 1 month courses which includes hands-on IVF, ICSI, vitrification, thawing, and we make sure that you know it with all the principles. You can actually sit on the machines, play with the immature gametes or unused immature gametes or the lysed gametes, and then we give you the practice on that. These are the few videos of our training. This is our training batch in Ghana, where we have a few gynecologists and embryologists got trained. We also provide batch IVF and ICSI services and simultaneously training. So this is our newer concept, because a lot of guys, the embryologists, cannot come here for a longer time. They cannot spend long time here because it is costly. They are going to leave their work. So instead that we have planned our way of doing it. We provide batch embryology services. We go to the center, we do the embryology procedures, and simultaneously whenever we go there as a professional embryologist to do their ICSI or IVF cases, we simultaneously train them. So we are right now providing our services in Burkina Faso, Ivory Coast, Congo, Togo, Ghana, and many other countries. We have a huge team, and one more thing, we have one more company that is really international. What we have seen so far is the instrumentation is very much costly in your part of the world. We help you to purchase instrument at a much reasonable rate, and disposables too. So anyone who is having any sort of requirement, they can contact us. So these are again few of the photographs of our training. We also have a urology department in our clinic. Apart from the whole IVF process, we are mainly dealing with, our urologist is very much dealing with erectile dysfunction, the penile implant surgery, penile enhancement surgeries, premature ejaculation management. These are all the male sexual issues. They have been taken care of at our clinic. And IVF services, apart from the routine IVF services, we have specifically male infertility management area. So let me introduce Mr. Ram Prakash Rao. He is our senior embryologist, and Ms. Komal Chauhan. She is also part of our team, core team, and they are all very much part of our training as well as our IVF program. Dr. Kaushal Kapadia, Dr. Kalpesh Kapadia is a urologist who is looking after our andrology and male sexual part, and Dr. Kaushal Kapadia is our IVF consultant who is looking after the clinical part of IVF. And so I thank you, INTAS. I thank you all the delegates who have spare time to have some sort of knowledge from this, and I hope I have given you some points which can be very helpful in your practice. And if you have any further query, we are open for question answer right now, and I am sharing my number as well as my email address, so you can always share your queries or anything you want to talk with me. You can contact us. So I think we are open for the questions. Okay. So sorry, we will be this